Hi, I'm Dr. Jim Harris. I'm the medical director for Restore. I operate out of our Denver clinic, and I've been doing that for about 26 years now. I take care of patients who suffer from hair loss, and they can be anywhere from 20 to 80 years old. So today we're going to be examining Elon Musk. Now, you know Elon Musk is one of the richest men in the world, involved in so many business ventures, Tesla and Twitter and SpaceX. You know, he's very controversial as well. He's playing a role in politics and getting his name out there. But one thing that interests people to a great degree, especially people that I see and I meet, is his hair. What's going on with his hair? So today we're going to be taking a look, and we're going to take a journey back in time and then follow him through and see what we can see. So here we have Elon Musk. He's in his late teens probably. And as we look at it, we notice that his hair is pretty full. You know, it looks like a normal teenage head of hair to me. Whether there's signs, if we took a look at his frontal hairline, if we moved his bangs out of the way, you know, we might see some early evidence. But it's pretty rare that someone that has a head of hair looking like this would have exhibiting hair loss at this time. So here we see Elon Musk at 31 years old. So obviously a good amount of time has elapsed, and it is apparent that he's suffering from male pattern loss. Now what we see here, the major clues are, number one, we're starting to see temple recessions. And the second thing is that he's not wearing his hair as long over his forehead anymore. And that sometimes we see people that are starting to have hair loss, they tend not to do that because the hair just looks like it hangs there. It doesn't look natural. So we're starting to see kind of an elevation of his frontal hairline. If we look at the distance from between his eyes to his frontal hairline, that's starting to elongate, get longer, and his forehead is appearing taller. So at this stage, if he would have come to see me, I definitely recommend that he needs to be on medical therapies right away. He needs to be on finasteride, minoxidil at a minimum. So if we look at this photo, we can almost surmise that his hair loss didn't start at 30 or 29. It likely started in his 20s. And maybe because of the way he wore his hair with his bangs, as we saw when he was 17, it wasn't quite apparent. But now that he's cutting his hair shorter, we definitely see the hair loss, and we can think that the hair loss probably started in his mid-20s. So there was a Dr. Norwood in association with a Dr. Hamilton that came up with a methodology for kind of classifying degrees of hair loss. And if you looked at that previous photo of Elon at 31 years old, he's probably around a stage 3 Hamilton. If he doesn't treat it, that's when he's going to progress. And he may progress to a type 4 where he's going to recess a little bit more. His frontal hairline may recess a little bit more. And although we can't see it in the photo, he's definitely at risk for starting to thin back in the crown area. If he doesn't use medications, he's surely on the path to going to further baldness, type 5 or type 6 hair loss patterns, probably within the next 20 years. Wow, here Elon's 32 years old, and if you take a look, it looks like, you know, he's thinned a significant amount more in the preceding year. I think there's a couple things contributing to this. Certainly, continued hair loss in the front is one thing, but he's also growing his hair a little bit longer on the sides. And this creates this disparity between the hair quality that he has in the front and the hair quality that he has on the sides. That's almost what makes people look bald, right? It's thickness in one area, thinness in another, and that spells I'm going bald. So, so this is all consistent with continued hair loss, and boy, should he be on medications immediately at this stage. So here we have some photos that show Elon after, the 31-year-old photo. And what we're seeing here is that he has his mind on this rocket here, but I think you ought to be thinking about his hairline. So again, he should be on the medications no matter what. Here a CNN business interview, pretty much the same as the preceding photo, still shows the thinning. The other thing that's apparent in this photo is that people that start to lose their hair think, oh, it's just not growing as long as it used to, or I'm cutting the top a little bit shorter here. But actually the growth cycles are actually changing in the hair follicles that are subject to the baldness. And what that means is they can't grow their hair longer. So you look at the hair on the side of his head, that grows perfectly fine, but the top just doesn't grow as long because it has a shorter growth cycle. And it may only be several months, and then the follicles go into a resting phase. And again, it just doesn't grow as long. And then we look at the next photo down in the lower right-hand corner, and all of a sudden things are different, right? His hair on the top of his head is matching the length of the hair on the side of his head. So this hair here is more robust, a little bit longer, matching the hair that he has on the side. What this tells me is a couple things. One is he finally got his mind off the rocket, and now he's taking the medications, which is a fantastic thing. because the medications change the length of the growth cycle. So in other words, instead of just growing for a month or two and then resting again, they may grow for 6 months, a year, or 2 years. The normal growth cycle is 2 to 4 years. So something is happening there. And I'm assuming medications plays a part in this. But the second thing is he could have had a procedure. We don't know if he had a hair transplant or not. And when you have a hair transplant, we're taking hairs from the back and sides that have normal 2 to 4 year growth cycles. And if you put those follicles in the thinning area, such as at the front, they will grow just like they used to. So medications are a possibility. Surgery is also a possibility. There's no way to tell if he had a surgery or not, but now it looks like his hair is becoming more in balance. In other words, the hair on top and the front is growing to the same quality as the hair on the sides. So now we have a profile view of Elon Musk, more recent photo, and we're seeing a couple things that look a little different from the previous photo that we just saw. So although his hair quality improved in that last photo, what we're seeing here is that there's more density in the front, and there's also a change in the location. If you look at the hair again at the frontal region, this area is much thicker. We're also seeing the possibility that his hairline has been lowered as well. So this really points to the likelihood that he had a hair transplant surgery. But there's something else that shows up here. I'm not sure if it's artifact or if this is true. So we see this area right here that looks like a linear scar. So this tells me that if this is accurate, that he likely had an FUT or strip harvest procedure. And that is a fine procedure, but one of the limitations with it is that if you cut your hair too short, you can actually see the scar. And it appears that's what's happening in this photo right here. I would say that the result of his transplant is very good. We have nice density, irregularity at the front, very natural appearing. So all in all, I think he had a good transplant. Now, if he was bothered by that linear scar, he has several options. He could have hair transplanted back into it. He could grow his hair a little bit longer. He can have scalp micropigmentation. So there's several ways that he could address that linear scar if the visibility causes a problem. So in this photo, we have Elon in an interview, and what's readily apparent because of the length of his hair is that he has had strip surgery previously. So that's seen right here in an area with low density going across the back. So the strip was actually taken from what we call the safe donor area, which is very appropriate. But the problem is, studies have shown that when you take a strip of skin out like that, you have a decrease in density of the hair above it and below it. And that creates a band of low density, which is readily apparent in that photo. So as I discussed previously, some of the options are to use scalp micropigmentation. He can have grafts removed using the FUE procedure and placed into the scar, or he could actually just simply grow his hair longer and it would not be visible. So one of the frequent complaints of people that have had FUT procedures is the scar. One of the reasons we developed the FUE procedure was for patients that wanted to wear shorter hairstyles, and that's what that affords you. But that doesn't mean someone that's had a previous strip surgery can't get back to the position where he can wear his hair shorter. So with the FUE procedure, if Elon were to have that initially, basically what we're doing is removing the same amount of hair, but we're distributing the scars over a much larger area. Instead of having a big line scar that goes from ear to ear, we have small dot-like scars that are distributed evenly, so there's no one area that has low density. Obviously, if it's done improperly, you can create low density areas, we call it over harvesting, and you can have splotchy results. That's the importance of finding a doctor that has significant experience in FUE so that that complication doesn't occur. So here we have Elon Musk again. You know, he's gone through the process as a younger man suffering from hair loss. We assume that he's going to have been treated properly. He saw the right physicians, likely on medications. He had a strip or FUT procedure, leaving him with those linear scars. But if you look at his hairline, it's appropriately placed. The doctor that did this surgery obviously knew what he was doing. He has great density. The flow of the hair is proper. It looks like it's kind of gradually going off to his right side, allowing him to have kind of a semi-part area on the left. So all a very good reconstruction. I think, you know, if anything I had to say about this process is that he had the strip procedure initially, which is a fine procedure, but he had some limitations to the length of hair. but with, certain accommodations, a grafting into the scar, scalp micropigmentation, or wearing his hair a little bit longer, he can hide that scar. So I think all in all, it's a very successful procedure. I think it looks great on him. It's appropriate for his age and is appropriate for him as he gets older. So this whole case illustrates kind of the difference between the strip and FUE procedures, the advantages, disadvantages of the FUT procedure. Great for creating natural results, but maybe not so great for someone that wants to wear their hair short. So I think Elon can go confidently amongst his peers and continuing with the rocket ships and the Twitter and, continuing his escapades around. So if you have hair loss or you're thinking you might have hair loss, I'd encourage you to get the right information. If you're interested, come see it. If you're interested, visit our website at restorehair.com. We'd be happy to answer questions. If you want to go further, we'll set you up with an appointment to come in for a consultation, talk to us about your hair loss and what the possible options are. We look forward to seeing you. If you like what you saw, please leave a comment below and let us know you want to see more videos like this. So like, subscribe, comment. We look forward to seeing you on the next video.